Hi, Susie. Nice to see you.
Oh, you too. It's been a while. An awful lot seems to have happened since last time I saw you. One of which is that you have actually managed to write this book, 21-Day Immunity Plan, in what, 6 weeks?
Yeah, I wrote it in quite a short space of time, Susie, for two reasons. One, wanted to get the message out, quite quickly in terms of the plan, in terms of helping people, especially when it comes to reducing their risk of severe infection from COVID. So that was really the primary reason, to get it out really quickly, basically. And that's why it's quite a concise book. I think it's probably at 21,000 words, something like that.
Yeah, that's
But
one of the
yeah,
things I loved about it because I literally read it Sunday afternoon, sat down with a nice hot drink, and I literally just read it in one sitting, which was great because very often I will have amazing health books. I'm going to have a whole load of them in the room where I coach. And I'll give one to someone and I say, you've got to read it. And they'll just take one look and say, Susie, I can't be bothered. Just tell me what it says. Just like paraphrase it.
yeah.
Um, but this is it. I mean, everybody could read this in an afternoon. And I would say, get yourself a copy. I was so pleased to see it in the Sunday Times best-selling list this week.
Yeah, yeah, it was nice to get that, up there because at least for me, it means that people are reading it, it's getting attention, and the feedback I've had has been really good as well from patients and members of the public, people who I meet or I speak to,
Yeah.
about the fact that they just think it's very concise and it's a 2.5 hour read.
And for me, this is just eminently sensible advice that you certainly don't need to wait for a pandemic to be reading this, because I think that's part of the point, isn't it? Is that this pandemic has thrown into very sharp relief the problems that we're facing in the UK and elsewhere with obesity, with type 2 diabetes, heart disease, etc. And it's the whole thing's kind of been a catalyst, hasn't it, for a real focus to be put on helping people, empowering people to reverse that, not just so that, God forbid, they succumb to COVID-19, but that they can live longer, happier, healthier lives. Would you say that's correct?
Yeah, I think you described it perfectly there, Susie. Catalyst, I think, is probably the way I would see the book, because many of these issues, as you know, have been with us for a very long time, have been bringing unnecessary suffering to millions across the globe, and have threatened and caused our healthcare systems to be on the verge, if not collapsing already. So it's not just about COVID, and it's not about your resilience to any infection or most infections, certainly the common ones. But it's about how do we move on from there? How do we actually, have a healthier population? And the final chapter of the book, I think, for me, was one of the most important ones, is because we know this is not an issue of individual responsibility. It never has been. Individual behavior is based upon the environment. So, of course, people need to know the science and what they can do, and I need to help empower them as I would with my patients. But on a population level, we're not going to sort this out until we actually sort out the underlying root causes, which are basically the environments in which we grow, live, work, eat,
Yeah.
and all the psychosocial stresses that affect people, even from poorer backgrounds, and even the way we live and the way we work.
Yeah.
So it's about, also I wanted to make sure that was in there, so that every individual reading it who gets empowered by the information also has a realization that we all have a role to play to help our communities as well. So that isn't just about the science of what you can do in terms of your own personal health, but it's about the fact that actually, this isn't going to have as much of an impact as it should until you get policy changes that then support people so that they can have healthy and happy lives.
Yeah. So this is such a fundamental point, isn't it? That this is not finger pointing at individuals. And I think this is I feel so strongly that we have to make this point just loud and clear, because I think a lot of people have felt a little bit picked on, if they are overweight, and suddenly there was this huge focus on people who are living with obesity, as it came to light very early on that they were far higher risk of suffering sort of dire consequences from COVID. And I've had a lot of people kind of thinking like, I'm being picked on for this. And what you're saying here is firstly, that this is not individuals' fault. We're completely getting away from that, but we are living at a time in a society, in a place in the world where we are kind of driven to put on weight by everything in our environment.
Yes, Susie, absolutely right. And it's interesting. It was Robert Lustig, my friend and colleague in the United States, pediatrician, who highlighted to me through a discussion I had with him, which I hadn't realized, but it made sense now, that the whole personal responsibility script mantra, you know where it came from? It came from big tobacco. That didn't exist before then. They're the ones that put that out there. That was their way of deflecting from the whole issue about tobacco regulation. And this is what the food industry have done. So people need to realize that even the psychological roots of a lot of this so-called fat shaming and people who do that, it plays right into the hands of the food industry. Because what it does is it shifts the blame onto the individual, not what they are doing in terms of how they're been spiking our food with sugar or how they market, unhealthy foods and target vulnerable members of society and children. The fact that they make foods so, these ultra-processed foods so hyper-palatable that, they interfere with appetite control mechanisms and all of those drivers. It's all a deflection game. And I think it's deliberate. So 100%, this is not an issue of personal responsibility. This is not pointing the finger. This is not fat shaming. This is something we're all in together. And in fact, as I highlight in the book as well, obesity itself, Susie, is just a tip of a diet-related disease iceberg, because many people who have a normal BMI will be adversely affected by excess body fat or by the foods they're eating through, the way that it interferes with, the immune system in terms of causing chronic inflammation. So I think we need to understand that. And one thing actually that reminds me is that I think we shouldn't forget that, pre-1970s, there wasn't an obesity epidemic, but there was still massive amounts of heart disease, a lot of other conditions that were there that were still driven by poor diet without obesity. So poor diet affects people who are normal weight. This isn't just about obesity. This is about, not getting enough, for example, whole foods and whole fruit and vegetables into your diet, not enough omega-3 fatty acids, not enough fiber. These are all things that can affect people who have a normal weight. This obesity is just the tip of a diet-related disease iceberg.
Yeah, such an important point to make. And one which I was oblivious to for most of my life because I was slim. And I just thought it was perfectly fine. When I think back to my school days, and I was at school kind of across the road from you, although a bit earlier than you, and I just used to sit in the classroom eating chewy bar after chewy bar when the teacher's back was turned. And there was a whole period where I used to eat dried spaghetti, like from the packet, just crunch on spaghetti. And just because I guess I was a bit of a carb addict and my blood sugar was all over the place because I'd gone to school on a bowl of shreddies and I had no idea what I was doing. But to look at me, I looked perfectly healthy because, I was this skinny kid. And yet I come from this family where type 2 diabetes is rife, literally rife on my mother's side. Everybody had it, a lot of premature deaths. And I didn't understand. I knew very little about type 2 diabetes, until really very recently. And I certainly didn't think that I was at any risk. But I see this all the time in other people as well. So I was coaching a group at a company, I think it was last year. And one of the guys was very tall, very skinny. And he was very mindful of what he was eating because he had recently nursed his father, who unfortunately had died from cancer. So he was trying in his head to do the right thing by his health. In his head, what he had come to the conclusion was he'd cut out meat. And I understand where he was coming from, although we could debate that. But I could understand why his lunch used to be a baked potato with chili con carne, and now he'd had baked beans or something else. And then what he'd done was, and this was where I really couldn't understand what his thinking was, he had started drinking Coke as part of his new regime. Wow. And he'd also started eating chocolate bars all through the day from the vending machine. So lots of companies have vending machines. People are bored at work. And I was like, okay, so talk me through the chocolates. And he said, well, I eat them because I can, because look at me, I'm really skinny. I was like, okay, well, let's talk about that. And I said, tell me about the Coke. I said, I I'm just mystified why you're drinking Coke as part of your kind of health regime. And he said to me, Warren Buffett drinks Coke and he's a billionaire and he's still alive. So I think he's 90 actually. So I think
Wow.
when there is such confusing information and people don't know where to source their correct advice from,
Yeah.
you're gonna look to anybody, aren't you? You know, I mean, you look at Donald Trump, he's eating McDonald's or whatever he gets for his takeaways, and you think, well, you know, he's managed to get to the White House, so there's nothing wrong with having McDonald's every night. There is mass confusion, I think, and it's really not people's fault that they're just
Yeah.
scrabbling around trying to make sense of it all.
Yeah, Susie. So I think, obviously there's some basic misunderstandings there amongst how people justify eating some sort of foods, and it's difficult to know. For every individual is going to have their different reasons what's underlying it. A lot of it is emotionally driven, and they'll find reasons and they'll find case studies or individuals that smoked all their life and lived to 100. There's something called the Churchill gene. So Winston Churchill, he smoked like a chimney, drank alcohol like a fish, he was obese, he probably had the most stressful job in the world and lived to 93. But what I would say is actually, if he wasn't doing a lot of those things, he probably lived to about 120. So, I think we've got to put it in context, and people need to understand this is about risk. It's about all these different factors adding up that then increase your risk of problems. It doesn't mean that every smoker is not going to get lung cancer. Probably only about 1 in 3 smokers ultimately get lung cancer, but 1 in 3 is still a very high probability. And if you have that across the population, you're going to have many people with lung cancer who didn't need to have lung cancer. So I think it's about very basic, explanations and helping people understand risk, which is not that well understood, unfortunately, or well taught. Certainly at school, even at medical school, there's a lack of communication, lack of teaching about how to communicate health statistics for doctors and patients. So I don't blame this chap. All we can do is try and empower and educate them. But I think the point that you're also making is ultimately, it's actually for people who are the least educated that are the worst affected by the environmental changes, who find it more difficult to make those so-called empowering or educated decisions. And therefore, it's up to us to try and think about, well, if something that's going on that's having a negative impact on the whole of society, then what can we do to make sure the whole of society benefits? And the people that benefit most, certainly from regulations, for example, in smoking reduction, are people who are the worst affected by smoking. So that what we're doing is we're creating an environment where the healthy choice becomes the default choice. So as he said, I can, for one aspect, he said, I can, drink these drinks because I'm slim. So there's a lack of education there. But the other side of it is it's because it's available. The vending machine's there. If the vending machine wasn't there and it was just serving water, for example, he probably wouldn't be drinking so much Coke, would he? So.
Yeah, it's so true. And I know that one of the things that you have been lobbying against is hospitals selling this kind of junk, which does seem very, very wrong on every level.
I think for people such as you and I, Susie, or people who are more enlightened or have more knowledge on this area, it seems very bizarre. But for actually what people don't realize, a lot of healthcare professionals, they don't understand, don't get training or have any even basic understanding of the impact of nutrition on health, which is not rocket science. Let's be honest about it. It's not rocket science. It's very simple to learn the basics. And then you just need confidence and you need to then be able to certainly at least prescribe certain dietary regimes to patients, which is what I do. But there is a lack of knowledge. And there's also this, there's still this mindset, Susie, that it's about calories and it's about healthy weight and it's about personal responsibility. So even if those chocolates and all that kind of there, a lot of healthcare professionals aren't aware about the environmental influences on their behavior. It's not sort of imprinted on their brain that they are, that this is actually creating, an environment of them being more sick or more ill or getting fatter, for example, and that for patients. So there's that element there. And then the other side of it is that they don't realize that actually, how important eating good, nutritious food is for health. You add in on top of that these very high palatable, enjoyable, addictive foods where people then get an emotional attachment to them. You have those three things together amongst the healthcare workforce, Susie. That's why you then can understand, and certainly I try and understand why from certain sections of certain doctors, not the overall established medical profession, because they're on it. I was part of that movement in changing, what the policy was from the medical royal colleges, for example, about their stance on junk food in hospitals, or the BMA. But a lot of doctors don't have that knowledge and have the emotional attachment to those foods. And then a lot of the time, that's some of it, not all of it, you get trolling or vitriolic, abusive attacks, some of which I faced on social media. And that's probably a lot of the reasons why they're doing it. So I try and take a step back and try and understand, why is this person doing it? Now, some people are just pure unsavory characters. We're going to get that in, throughout all walks of life. But a lot of that behavior is driven by those three things: lack of knowledge, and a lack of sort of, and an emotional attachment to cakes. And, somebody I won't name, who's quite a prominent doctor, was very combative against a lot of stuff I was saying. And I found a few sort of, and just my observation, but I found a few pictures or tweets this person had done where, and this is independent of any discussion with me, just about the fact that how much they enjoyed cake and were taking pictures of lots of cake. So automatically for me, I realized this individual has a very strong emotional attachment to cake. And if a Dr. Malhotra comes along and says, oh, we shouldn't be, serving, certainly promoting or, serving sugary foods in hospitals, I can understand why that person might get angry about it.
Yeah, because you
doesn't
really
justify it, but I can understand it.
Yeah. I mean, I very rarely venture onto Twitter these days, but I know that you've had some serious mud slung at you. And I think a lot of people will be left scratching their head when they read this book, wondering how on earth anyone could possibly find anything objectionable in it. Because for me, it's just common sense. And this is life-saving information that everybody should know, put in a very, very simple, accessible way.
Yeah. Susie, sorry to interrupt. I would add,
Yeah.
I think a lot of these people, again, these trolls haven't even read the book anyway. So you're absolutely right. I think let them read the book. Of course, I'm up for scientific debate. There are areas and gaps in our knowledge and in the medical literature in terms of how robust certain studies are. But at the end of the day, we have to use the best available information we've got, which is what we can do as doctors. And then it's also about clinical practice and then how does that translate into my own clinical experience and of others as well. There are many people out there who are seeing these results. Susie, that as a health coach, you see these results in people. GPs like David Unwin, for example, who's gathering very good data in his own practice on how he's sending, huge proportions of his patients with type 2 diabetes into remission. So this stuff does work. Now, it's not going to be perfect. It's not going to work for everybody. But what the problem we've got right now is actually the health information that people are using to make clinical decisions, combined with the food environment that's unhealthy, is actually the very worst possible bits of information and, the worst sorts of drivers into ill health that we've got. So this is certainly the best approach I think we have at the moment. And that would probably, if it was, something that was ingrained within people's minds, if it influenced policymakers, then I have no doubt, and I would stand by this, we would reverse these epidemics of obesity, type 2 diabetes, the prevalence and incidence of heart disease, cancer, dementia, Alzheimer's. We would start to see big changes happen within a very short space of time, within a few years, absolutely across the population. Yeah. There's no doubt about that. We've got the science, but we're then battling these powerful vested interests, and that's something that, myself and other people need to be aware of, because it then means you've got to have a thick skin. You've got to grow a rhinoceros hide, because this is part of any revolution. And this is what we're talking about. We're talking about health revolution. It's going to have all these sorts of attacks, and, people who benefit personally and financially, whether the institutions or their salaries are dependent on the status quo, are going to be the biggest, often the biggest obstacles to change.
Yeah. And I think for people outside of this whole, what you've just described, who are kind of just looking in, who are just normal members of the public, it's quite bewildering, really, when you look at someone like Tom Watson. So for people listening in other parts of the world, Tom Watson was, up until fairly recently, the deputy leader of the British Labour Party. And he lost, 7 stone and reversed his type 2 diabetes and has kept that weight off since. That was a while ago. I think he came across the Pioppi Diet, which you'd written a few years ago. He followed the advice and very effortlessly lost a whole load of weight. I mean, 7 stone, that's serious amount of weight. So as you say, you and I, we see this happening. That is not a rare case. We both see that what looks like a miracle recovery very regularly. And yet you're still seen as a bit niche, which it's really hard to understand with all the evidence base that you have. And as you say, the work of Dr. David Unwin, and we have this epidemic of type 2 diabetes here, which seems to be getting worse by the minute. And I remember going to a talk it was the head of diabetes in my area where I live in Manchester at a community centre. And I was so excited because it was all about empowering people to take control of their diabetes. I was like, yes, this is just what we need. I was sat on the front row like girly swat, so excited. And he was a lovely guy. He brought his PowerPoint presentation. And for the first 5 minutes, I was just like bouncing up and down with excitement in my seat because he said, I'm going to be empowering you. Because see, there's a whole room of people who look pretty sick, a lot of them. And as the talk went on, honestly, I had my head in my hands because it was just one slide after another of different pharmaceutical trials, clinical trials. There's this drug coming out, there's that drug coming out. This one will curb your appetite. And it was just soul destroying to see what was being passed to people. At one point, someone put their hand up and said, I've heard that it's possible to reverse type 2 diabetes. Is that correct? And he said, categorically not. Categorically not. And that was what they went away with. And then someone asked about sugar. He said, no, there's no link with sugar. There's no link. He said, look, just don't have a tub of ice cream every day. So the guy said, okay, so how often can I have a tub of ice cream? He said, well, every other day. Now, as far as nutrition advice goes, that's pretty shoddy. I just don't think that is that helpful to a room full of people facing chronic disease to then go away with. So by the end of it, I was practically levitating out of my seat, Aseem. And you can imagine, I just wanted to grab the microphone and take over the whole talk. But I just said, are you not familiar with the work of Dr. David Unwin, who's like 45 minutes away in Southport? Or Dr. Aseem Malhotra or Dr. Rangan Chastity, all these people who are doing the work day in, day out. How is it then that this is not yet known by a lot of the medical profession that it is possible to reverse? Because you think it'd be pretty big news that you could reverse type 2 diabetes.
I think the first thing I'd say, Susie, is, I think knowledge doesn't necessarily equate with intelligence. As Professor Richard Feynman, eminent physicist of the modern era, said, you can have a PhD and still be an idiot. So I think we should just acknowledge that don't presume that I'm talking about even when I have interaction with all my patients, I actually always tell them that I'm learning something from them. Every patient that sees me is different. Every patient that sees me has different experiences. I'm there to use my skills and knowledge to help them either reach a diagnosis, talk them through their diagnosis, reassure them, give them a lifestyle plan, all of those things. But I always say to them, listen, I'm also learning something from you. So it puts them on for me, certainly I find patients feel much more comfortable opening up to me and feeling that I'm not there to judge them, I'm not there to patronize them. And I'm always interested in experiences they have of things that have helped them in terms of whether it's getting over a certain health condition, for example, or managing it or dealing with it. So I think we have to have a bit more. One of the things that one of my mentors, who was a former chair of the Medical Royal Colleges, Professor Terence Stevenson, he then became the chair of the GMC, and later got a knighthood. He spoke in a conference a couple of years ago, and he said, in terms of the medical profession, we need to exercise more humility and less hubris. So I would add that in first and foremost. So there's an element of hubris that unfortunately is a barrier to change. I think the other thing is lack of knowledge. Really, it comes to lack of knowledge, Susie, as well. That's one thing. I don't think that's the only excuse, but as you said already, there is evidence out there. It's quite clear when one looks at the totality of the evidence. It's not that new. It's been there for a while. That certainly when it comes to comparing different approaches for type 2 diabetes remission, the low refined carbohydrate option in particular is the most effective. It may be only slightly better than a whole food so-called low-fat diet, but it's definitely equally, if not more effective, and often more preferable for patients. And there are very, very senior people, and I've had interaction with people. For example, for me, isn't just about what my own clinical experience and being inspired by my patients. It's about policy change. A lot of stuff I do, Susie, is linked to influencing health policy, whether it's through my work with the medical colleges, whether it's through getting BMA to change their policy on junk food, whether it's me working as I'm a trustee of the King's Fund, which is considered, a very respected independent health think tank. So for me, it's about changing policy at the top end. And what that means is I also have direct interaction with policymakers, including people like Matt Hancock, Secretary for Health and Social Care, who had contacted me personally after I'd highlighted the reason Boris Johnson got ill was probably because of his weight from COVID, to ask me for evidence linking COVID and obesity. And it's not just about, there's an element of what the information that's there, but let's not be naive about this. The public need to realize that there are huge, powerful vested interests, money interests basically, that are stopping that information being disseminated across the whole population. So you'll read the occasional articles, things that I get out there, or something, a series in the Daily Mail on David Unwin's work or whatever. But ultimately it's for the policymakers to make those changes. And they won't make those changes if they are getting backhanders from industry, unfortunately. Let's just put it very bluntly. And I know this happens because I've been told by very senior people this is what's going on. So I know this is going on. But what does that mean? I mean, most people listening to this who aren't aware of it would probably be absolutely appalled to hear this. And most people would not accept it. This is unjust, it's unfair, it's not right. And therefore, to change the system, we need to make this injustice visible so that the whole population becomes aware. Once they become aware, it's much more difficult for people within these powerful positions to really get away with obfuscating information that's going to help people get healthier.
Yeah. So, I mean, as you say, people have been trying for a long, long time. I think of Jamie Oliver, who's been lobbying for years to get things changed around junk food promotion, etc. And things just seem to have been moving so painfully slowly. And then suddenly this pandemic happened and you came along and pointed out about, I remember reading that it said top cardiologist links Boris Johnson being in hospital with his weight. And I was like, whoa, gosh. And there was a bit of hoo-ha about it initially, wasn't there? And then actually Boris Johnson himself later made that association, didn't he?
Yeah, absolutely. And that was, for me, that's promising that he's taken it and he realizes this is what's been happening. And I'm sure, that was disappointing. I was literally probably the only person who had the opportunity, certainly in mainstream media, to bang on about this even before we had this pandemic hitting the UK, before we had the huge number of deaths, to say, this is the time now. We know what's happened in China and Italy. We know the groups that are affected. This is the time now for people to get a public health message about what they can do is make sure that they look after what they eat and about the amount of exercise they're doing and sleep, etc. No, it's not, of course, not easy for everybody, but the public health messaging should have been then. It wasn't. So, it was promising eventually that, I wrote an article that featured on the front page of the Telegraph as a commentary after a European Scientist article. Then Good Morning Britain got me on, and then it started to have an impact. And of course, Public Health England then came afterwards. But Public Health England should have been saying this from the very beginning. And in relation to that, Susie, again, I won't name this person, but let's just say somebody extremely senior in Public Health England who I met, who had probably been regarded certainly through, media spats, if you like, in terms of me challenging some of the advice I was given, someone who people would probably see as my enemy. I had a very, very friendly chat with this individual who I actually bumped into on the street. We had a coffee. And I said to this person, I said, you're responsible. You have ultimate responsibility for deciding what goes onto the Eat Well guide. So for people who don't know, this is supposed to represent health eating in the NHS and what people should be eating. And you see it in canteens across hospitals. This big chart with a plate with the different proportions of different types of foods on it, from fruit and vegetables to tin food to lots of starch and starchy carbohydrates. Fine, that can be debated. But what can't really be debated, in my view, is the fact that in the corner of the plate they have crisps, chocolate bars, cakes, and they put that on there. And they just put vague advice, eat less often and in small amounts. That's it. And I know that when the plate was being made up, they had to declare this, that a significant proportion, almost 50% of the people who are involved in making up what goes on the plate were representatives of the ultra-processed food industry, companies that profit from selling ultra-processed food. Companies like Kellogg's and McDonald's and Pepsi and Coca-Cola, they were involved in deciding what goes on the healthy eating guide for the public. Just think about that for a second, right? For me, it's clearly, as Zoe Harkin wrote an article on it, obesity researchers saying this is the healthy eating guide or Eat Well guide created for industry wealth, not public health, or words to those effect. So I asked this person who has a role to play and just said, can you please justify that to me? Can you explain that to me? That person's response was, Aseem, you've got to understand one of the biggest contributors to our economy is the food industry. That was their answer. Not that this should be independent scientific advice. That was their answer. For me, Susie, that was more than enough for me to realize, that we basically have the corporate capture of public health, and look what damage it's done to the public. So for me, that is acknowledgement, okay, that, my suspicions or the evidence of what I thought to be true is correct. And then I personally feel a responsibility, Susie, to do something about it, to talk about it, to highlight it, either through, this sort of podcast that we're doing or through my interviews on mainstream media. Because unless people know about it, we're not going to be able to change the system.
Yeah, I feel equally as passionately as you do, Aseem, particularly as I used to work in the food industry, as you know. So I've kind of seen it from the inside. And when I saw you tweeting about the donuts that were given to hospital workers, and I thought back to the time that I was handling accounts for big junk food companies, which I did. And that would have been a wonderful PR opportunity. That was the sort of thing that we would sit round in an office and brainstorm, because it gives such a healthy halo to the brand. That corporate social responsibility, you just can't buy that goodwill. It's amazing. So I've been on the other side of the fence, and, I can see exactly what's going on, and they do it beautifully.
And Susie, it was a very polarized response, and there was a lot of positive support, as you saw, from my tweet in responding to one London NHS trust that had basically, was promoting and endorsing and thanking Krispy Kreme donuts for donating 1,500 free donuts to their staff in the middle of the pandemic, when these are the very foods whose consumption of which, of course, we know is bad for you, but probably also increases risk of type 2 diabetics getting complications from COVID, because data already published showed that people who had poor glucose control, who were type 2s, had a tenfold increased risk of death versus type 2s who had good glucose control. And just one of those Krispy Kreme donuts in a type 2 diabetic would send their glucose through the roof. So there was all that in the background. But the main issue was the fact that this was being promoted and endorsed by an NHS trust, on the background of which, Susie, which I have been very much part of, that the NHS England had basically, in a paper that I co-authored with Simon Stevens, his fellow, and I know Simon Stevens, the NHS, CEO of NHS England very well. I know his personal views. I know what he said. He absolutely is, appalled with the fact that we are selling junk food in hospitals and this is on sale. I know that for a fact. He said it publicly. Anyone can ask him and he'll say this isn't acceptable. So why was so there's a complete disconnect here going on between a trust that's, using this as, and I think it's probably naivety. I don't think they deliberately or maliciously did it. But what was really interesting, in a way, in one way, a good thing, because it kind of, again, reiterated or highlighted the real lack of knowledge amongst many, even influential doctors, is the doctors were vitriolic. There was a kind of a backlash from doctors who thought that it was, I shouldn't have been tweeting such a thing, let the nurses eat their donuts, which was never the point of the tweet anyway. It wasn't about stopping people eating donuts. It was about an NHS hospital promoting and endorsing Krispy Kreme, and falling into that trap that you've already highlighted, which was just a marketing opportunity for them. Krispy Kreme donuts don't care anything about your health whatsoever.
Yeah,
they're a business. They're there to make money. They don't care about your health. And it was exploitation of NHS staff and the whole pandemic that they were taking advantage of. Let's just call it out for what it is, a blatant marketing and cynical marketing opportunity from a company that doesn't care two hoots about your health. They are there just to sell their product. And they use the NHS to do it. And it's outrageous. It's an absolute scandal, in my view, speaking as a doctor.
Yeah. I mean, I know personally speaking, because I worked in the food industry for many years, I loved it. I mean, I loved working, doing PR for the food industry. It's very dynamic, lots of fun, lots going on. There was always loads of new product development. And I didn't see anyone doing anything nefarious. But what I can categorically say is that there was no discussion or thought at all of people's health. It just is not on their agenda. It just doesn't enter into the conversation at all. As you
It doesn't
say,
need to be, though. They're there to make money.
They've got to shift product. They have to shift more and more
People
and more
need to
product.
realize that, absolutely. So Susie, in a sense, I'm not blaming Krispy Kreme in this particular instance. I'm having an issue with the people that are supposed to protect our health. They have really, one of the things I talk about when I talk about the vested interests that have influenced medical science. And I quote a cardiologist called Peter Wilmshurst, who spent, 30 years basically exposing scientific fraud, if you like, in medical publications. And he says that, the real scandal is that doctors, academic institutions, medical journals that have responsibility to patients and scientific integrity collude with industry for financial gain. So the real issue, to be honest, personally, I think the most guilty parties in this whole issue and the wider issues when we talk about what's been going on, whether it's about too much medicine, over prescription of drugs, whether it's about the food industry and organizations such as Public Health England, is really the complicity, the acquiescence of people in powerful positions who should know better, who are there to protect the public and patients and doctors from the excesses and manipulations of industry. They are really to blame. They need to look in them. We need to realize that those people haven't done their job properly. They have not followed their duty. And those are the people I think are much more to blame than industry themselves.
So you touched there on overprescription of medication. And I think one of the statistics in your book, which I was familiar with, but I don't think most people would be familiar with this, is that is this correct? The third leading cause of death globally, people might be very surprised to hear, is...
Yeah, so Peter Gosha, one of the co-founders of the prestigious independent Cochrane collaboration, what his analysis suggests that the third most common cause of death after heart disease and cancer is prescribed medications. So essentially side effects from tablets that are prescribed by your doctor. And people might debate whether it's the third commonest or whatever, but it's up there. It's certainly in the top 10, probably the top 5. It's a big, big problem. And yes, you're right. Most people aren't aware of it, because if they were, it would at least make them think twice, or certainly you probably encourage better conversations between doctors and patients about really the true benefits of drugs and potential harms, and are there alternatives that they can do instead of taking a pill. That doesn't mean to undermine the whole of medicine. Of course, I love medicine. I love cardiology. I can't imagine doing anything else. I spent 5 years in medical school. I've been, over 19 years a qualified doctor, almost 2 decades I've worked in the NHS. I love it. And we've done some great things. Modern medicine has achieved some great things, especially in acute care. But in terms of the chronic disease management, and in terms of the major issue threatening health of the population, now the economy and our healthcare system, most of these pills that are prescribed or people are taking really don't have very little benefit at best. Most people don't benefit. And if you're unlucky enough to get side effects, then you're going to end up, miserable as well. When you combine that with a lack of attention to the lifestyle changes, which are going to improve your quality of life and likely improve your longevity, then you can understand why we've got a major problem, of too much medicine. We are far from the gold standard of informed consent in our current healthcare system at the moment. And that is unacceptable. And that is another, driver of an over-medicated population that results in, unfortunately, many people, especially elderly people, suffering sometimes fatal side effects from drugs, or drugs that, there are too many drugs that they're on and they fall, they break their hip, and then they die because of that. So this is a huge problem. This is not on the periphery, Susie. This is front and center of what is wrong with healthcare at the moment. This is not a small peripheral issue. It's right in the center of it. And it's so important that the British Medical Journal, one of the most respected high-impact journals in the world, now known as the BMJ, they've launched a Too Much Medicine campaign since 2012, 2013. They launched this campaign, and this is the front and center of their campaigning. Another medical journal in the US called JAMA Internal Medicine is doing the same, less is more campaign. Why is not every other medical journal doing it? Because medical journals take money from the pharmaceutical industry.
Yeah.
So you can do the math. It's not rocket science to work out what's going on.
I wasn't actually aware until very recently that my own grandma, my maternal grandma, who was one of the many people in a family who was type 2 diabetic, and she went into hospital with a funny turn one Christmas day at the age of 52. It's only, 3 years older than where I am now. She was put on morphine and that was it. She died that day. From, as you say, there's drugs that are administered, wasn't a mistake, wasn't, and I think that's very much underappreciated by people, that we're not talking here about drugs that the packets were mixed up or someone was trying to harm someone. This is just in the normal course of prescribing drugs correctly that people are losing their life. So that's quite scary when you stop and think about the numbers.
Yeah, and the doctors, the problem is, Susie, is that the doctors, the clinical information on which doctors are making decisions with patients, and the information doctors are being given to make those clinical decisions is biased and corrupted by commercial influence. So what that means is doctors themselves will have an over-optimistic view about how beneficial the drugs are. You combine that with the fact that side effects are often underplayed through the trials and the pharmaceutical industry withhold information that would change that decision-making process. That then feeds into the whole system. And when you're making clinical decisions on biased information, you're going to get suboptimal outcomes or bad outcomes, and that's what we've got.
Yeah. So going back to COVID, so what you would have liked to have seen was, in addition to the, stay home, wash your hands, wear a mask, you would have liked to see eat real food.
Eat real food, protect the NHS, save lives. Absolutely. And in fact, I think that should be a message going forward, certainly for the next several years, until we actually manage to get the population. I mean, I think there's a good analogy. Of course, people would argue everybody needs food, and you can't say that, ultra-processed food is the same as a cigarette, because you don't need cigarettes, right? But you need some food. You'll get something out of ultra-processed food, although, as you know, the nutrition is not very good. And it encourages overconsumption. So, and probably has an adverse effect on the gut microbiome as well. So there's not very much good to say about ultra-processed food, but it's still some form of energy. But I think that, when you look at the chronic disease now created by these foods, it is way more disease and death. These poor diet causes way more disease and death than physical inactivity, smoking, and alcohol combined. So I think that message needs to be reiterated again, and again. And what I was going to say is that if you think about it now, people will probably be shocked to think, hold on a minute, more than 50% of men and women in 1950, 1960 were smoking, right? Were smoking cigarettes. Doctors were smoking in their consultation rooms when they were seeing patients. You'd find that quite shocking now, wouldn't you?
Yeah.
So actually right now, more than half of the British diet is ultra-processed food. So actually, we would probably see a big decline in a lot of these conditions and diseases if we got our ultra-processed food consumption to maybe less than 10% of what people are eating. Certainly, way, way below the 50% that they are consuming such products now. In a similar way to what we've got, cigarette consumption hasn't completely been eliminated. I think the figures are something like 17% of the adult population are smokers now. But that's a massive drop from what it was, a few decades ago. So we should just learn from history, think about how we tackle tobacco, use similar interventions to tackle ultra-processed food, get people eating real food, get compulsory food and nutrition skills into schools. It's a skill for life, cooking. It's everyone should at least be empowered with being able to know how to cook. And it's fun, it's therapeutic, it's good for your health. And then we have to think about regulatory interventions that are going to improve our food environment so that the healthy choice becomes the easy choice. And that's things that I've talked about in the book, like taxing ultra-processed food and using that money to subsidize healthier food, banning junk food advertising, ultra-processed food advertising, dissociation of ultra-processed foods and sport. These are the sorts of things we need to do if we're going to really win this battle. But I would say, as a doctor, we need to look in the mirror. Okay, we need to look in the mirror. We can start in our own backyard, and let's at least get this introduced into hospitals to make hospitals actual environments that are in its totality conducive to good health and is sending out the right messages. And the moment we haven't got that, until we get that right, I don't think we'll get anything else right.
You know, it's so true. I'm thinking back now to a time when my husband was in hospital a couple of years ago, and I wanted to buy my daughter some felt tips from the W.H. Smith. I mean, it's a stationery shop. I couldn't find felt tips. What I did find was wall-to-wall chocolate. I mean, you have never seen, Aseem, so much chocolate. It was like, you don't need to bother driving to Birmingham to Cadbury's World. I mean, you could just nip to your local hospital. It was unbelievable. And you just think there's just something wrong somewhere. Why would you need magnums? It was winter. Why would you need the most enormous thing chock full of magnums for people in hospital who are already poorly? So, but if people are listening to this and maybe they're overweight, maybe they're not overweight, but either way, they want to be protecting their immune system and lowering their risk of either developing a chronic disease or suffering, who knows what from COVID. What can they start to do? Okay. What is the simple advice that you've encapsulated here? It is, as you say, really simple on the food front, isn't it? It's kind of eat real food. But could you elaborate a little bit on
Yeah,
what that is?
I think the big issue there, I've written this book in a way that allows people from different cultures and different preferences and backgrounds to be able to incorporate, the initial basic plan of the diet, which is actually, first and foremost, is to cut out ultra-processed food. Very simple, comes out of a packet, 5 or more ingredients, usually with additives and preservatives. Don't eat it. It's ultra-processed, right? So there's an international classification. People want more research to look up a little bit more info on it, and it's free online, called NOVA, N-O-V-A. It's not an abbreviation. It's from Brazil, and it cites lots of studies linking these sorts of foods with ill health, but also gives a classification system from minimally processed food to ultra-processed. So get rid of the ultra-processed and minimize low-quality carbs. So that means cutting out all sugars, fruit juice, refined carbs. So these are your breads, pastas, rice, basically carbohydrates and lack fiber. It doesn't mean you don't have to have any of it, but certainly what I would say for the first month or first 21 days at least, is to break that refined carbohydrate addiction, so you can, recalibrate, if you like. So those are really the two main messages when it comes to food. And then when it comes to other things, it's about moderate activity. Just a 30-minute brisk walk a day is great for your health. And think about your stress levels, meditation, sleep, and it's all there in a bit more detail in the book itself. So if you want to get the book, then you'll have a bit more of an understanding. As you've already highlighted, Susie, it doesn't take very long to read. The whole book takes about 2.5 hours. But if you want to skip the bits before then, I don't think they will. I think they'll find it probably quite interesting. Then they can just go straight to the 21-day plan.
Yeah, great. Okay, so
and Susie, I think the other thing to say, by the way, is this is just the beginning of the journey, because people, I've written about what people do afterwards. And of course, everybody's going to react differently. Everybody's going to find it, some people are going to find it easier than others. And it then will probably need different things to think about. Of course, I've mentioned what we can do in terms of food environment and be advocates for it, ultimately for the population. But for individuals, they may need extra support. They may need to see a health coach. They may need to see a dietitian or nutritionist. So I think that just be wary of that, but do that for the first 21 days and see where you're at. And I'm pretty sure the overwhelming majority of people will notice a significant change in how they feel and in terms of their health in that 3-week period.
Okay. And this is, and just to be clear here, it's not just to do with losing weight, having more energy. This is actually helping our immune system to function more optimally.
Yeah, so it's about normalize keeping immune function as best and most resilient as possible, both through reducing sort of what we call metabolic risk or conditions related to excess body fat, but also simple things. I mean, we know, for example, that moderate activity increases the function of T cells, which are involved in the innate immune response. So there are things like that people will be empowered with. But on the other side of it, too much exercise actually dampens the immune system. It increases stress and cortisol. And actually, what's interesting, one of the exercise chapter, as I highlight, is that, and this is something I even experienced once as well, that when people do too much exercise, those people end up getting more respiratory infections, and even people who are completely sedentary. So the bliss point is moderation when it comes to exercise, and certainly when it comes to the immune system. And it's also things about getting a good sleep and reducing your stress levels all have an impact on immune function. Absolutely.
Yeah. And just on that point on exercise, we do need to get Britain moving, that's for sure. But it is very important to emphasize that you can't as you say, you can't outrun a bad diet.
Or in
And
Boris's case, you clearly can't outcycle a bad diet. I mean, Boris was cycling around London as London mayor, and he was obese at the time. And I'm not saying, I know this because I had personal interaction. I was an advisor to the London Food Board when he was mayor. So senior people there would tell me they were concerned about Boris and his weight and his health. But he was cycling everywhere. So it wasn't the lack of cycling for Boris. It was probably what he was eating.
Yeah. And I see this so often, people, guys especially, who are cycling, you know, insane amounts of miles every day, and then will come back and eat the body weight in biscuits. And they are flabbergasted when they get a heart attack. You know, they just can't understand. There's like some mistake. I mean, I was once in a corporate wellness workshop, and one of the guys was training for Ironman, and he'd go out and do all his cycling and everything, come back and get a bowl of sugar and actually eat the sugar off a spoon.
Yeah.
And yet
it's very sad, isn't it?
Yeah. So
it's tragic. It's nothing short of tragic.
It is. So I think we really need to get this message out that you can't, it's not just about, well, get on your bike. You know, there is a lot about this. Just get on your bike.
Susie, let's be very clear. In terms of hierarchy, the most important thing you can do for your longevity and your risk factors in your health is diet. There's no exercise that even come close. Not even in the same ballpark. Not even in the same ballpark. And I'm speaking as somebody who is an obsessive exerciser. But I feel good from it. Yeah, it's great for health and, you know, mental well-being and keeping moving and all that. I'm all for that. But when it comes, ultimately, the diet should be at the very top of the list. And you should also think about, what are you fueling your body with for exercise? And sugar, you know, you don't need any sugar. Exogenous, you don't need any dietary sugar or carbohydrate for that purpose at all, actually. There's not an essential, what we call macronutrients. So, but unfortunately, I don't blame this person. A lot of the way people behave is determined by marketing messages. It isn't based upon evidence. It's, you know, the people buy things, Susie, more upon the way it's marketed, not the nutritional content. We know that. There's evidence for that. So this is, you know, people are being, willfully deceived. So, this needs to be a wake-up call. This is willful deception. This is, you know, and it's very sad, but, you know, that's why we need to change policy. So a lot of the work I do, you know, people can read the book. That's great. Matt Hancock is mentioned. He's got a copy of the book. You know, politicians will, are contacting me and are getting copies of the book. So for me personally, you know, I would rather the book sell, you know, 10,000 copies and influence policy so that people who've never even heard of the book or me are affected by, you know, the messaging that I put out there or the influence I've had, than sell 1 million copies and that not happen.
Yeah. So just to wrap up, the standard advice of eat less, move more, you know,
complete and total rubbish, unscientific nonsense, corrupt. That's it. Very simple.
And spectacularly unhelpful for people as well. Just really, really unhelpful for people.
I think that's a very polite.
I think
it's very polite of you to say unhelpful, Susie. I think it's just fraud. It's based on deliberate fraud. That's what it is. Let's call it out for what it is. Eat less, move more is ultimately fraud. And what's the definition of fraud? People who have who deceive people for personal and financial gain. That's the root of it, actually. The root of it ultimately is coming from the food industry. So that message is what I would call fraud. Eat less, move more.
Yeah. Yeah. And really hard for people, you know, who are overweight, the knees hurt, they don't have the energy to go, you know, for a run. And yet they're made to feel more guilty, full of shame, you know, self-loathing, all of these horrendous things. And I think that shame is the most horrendous way to try and get people to change. It literally doesn't work, and it just causes so much harm. So I loved a lot of the book in which you were really, you know, there was just none of that. There was, you know, it was the opposite approach, which I was really, really pleased to read. So do you have any final message for people who, you know, maybe either themselves or someone in their family has been really struggling this year? Maybe they have a strong family history of one chronic disease or another, and they don't want to go down that road. So what can you kind of leave people with?
I would say, listen, there's always hope. Never lose hope. These things can change quickly. You can feel awful one day, and the next day things can be completely different. So don't give up. Don't lose hope. Lifestyle changes can have a rapid effect on your health. and just hang in there. That's what I would say. And you will see those differences. And we've all been there. We've had difficult spots. Everybody has to experience some form of suffering in their life at some point, but it passes. Nothing is permanent in this world. In the same way, your suffering is not permanent either. So just be hopeful and give it a go. And then once you notice the differences, spread the message and think about
it's never too late. It's never too late,
absolutely.
is it?
Absolutely.
So
not.
whatever
I've seen
age...
people, elderly people who've sent their type 2 diabetes into remission, so it's never too late. Not at all. Absolutely.
Okay. Fantastic. Aseem, I want to thank you so much for spending time today. I know you're really busy with book promotion, and I'm so grateful. It's been ages since I've had a chat with you, so it's been really nice to catch up. And I wish you so much luck with getting this out to people who really need to read it. And let's hope that policy starts to change soon.
Thank you. Thank you, Susie. It's been an absolute pleasure speaking to you.
Thanks, Aseem. Take care.